Hi, I'm Dr. Ryan with Passive Movement, Health and Wellness. We're going to do a myofascial release technique for the muscle known as TFL, or tensor fascia lata. And that muscle sits from the top of the crest right down to that bony protuberance that you feel on the side of your hip, called your greater trochanter. Part of it is situated kind of coming back towards the glute. A little bit of it is in the front. So we're going to play around with some different angles to hit different fibers. The foam roller may be a good start, or if that's really not hitting it, then we're just going to reach for a lacrosse ball. But what we're going to do is start on the floor and position this right off of our hip bone, or that crest of our pelvis, and get this leg underneath to just relax, and then take the top leg and just bring it across. So that way all the pressure is going straight down through into this foam roller. And this may be a lot for you, so you may just want to take the first 20 to 30 seconds here to just relax, just breathe. You can start to explore and scan for little spots that feel more tender. But if this isn't getting much for you, you may be able to tolerate coming down to your shoulder and laying down more fully on top of this, which would help you then expose a little bit more towards the crest and the front of that hip. Again, if this is not really touching on what you need to work on, then we're just going to use the lacrosse ball. And in some cases, it may help depending on the shape, your physiology. You may need to put a yoga block or a textbook underneath of this lacrosse ball to essentially allow it to push up more into that tissue. But what you can do is lay down again, and I'm just gonna find that spot that feels quite sore, and I'm just gonna focus on my breathing, making sure I can get that left leg to relax. And once it is, then I'll start adding forward, backwards, up and down motions against the floor. It's hard to add movement from that leg, from this position. So most of the relief or change in pressure, I should say, is going to come from how we move the pelvis on top of that ball or foam roller. So no matter if you're using the foam roller or the ball, you can just start to bring your belly button towards the floor and then square it up, rolling it back. If you need to change the shape of your leg, you can pull your leg forward a little bit so that your knee is bent, your hip is starting to flex in front of you, and you can go up and down to hit some different fibers here of that TFL. So stay with your small movements and just explore up and down, maybe some brief circles in both directions, but you're not trying to make big stretches of movement on top of the ball or the foam roller. So there you go. That's a myofascial release technique for your TFL.